Looking to lose a little weight? Just freeze it. The negative results of fat freezing are far from anything you want to see on your body. Some of the results of these risks don't appear right away during the procedure. They show up later. Simply put, this is where your expectations may not match results, and fixing is far more invasive than the original procedure.
BeautySeek is not a medical provider. This is not medical advice. Always consult a licensed professional.
Welcome back. I'm Sam, and this is BeautySeek. Thank you for joining us as we explore the beautiful results possible and the risks of fat freezing. Looking to lose a little weight on the belly, underarm, inner thigh? Just freeze it. All you need is a fat freezing machine, the right operator, and to be aware of one of the biggest risks that can result from using fat freezing machines. The appeal is obvious. It sounds simple, it sounds controlled, but simple doesn't always mean harmless. Fat freezing is a non-surgical body contouring treatment that uses controlled cooling, known as cryolipolysis, to damage fat cells beneath the skin. It's FDA-cleared for areas like the abdomen, flanks, thighs, arms, and even under the chin. What most patients don't realize is that FDA-cleared does not mean risk-free. There are risks, including complications that many patients aren't fully warned about before they book a fat freezing procedure. Some of the results of these risks don't appear right away during the procedure. They show up later. Fat freezing appointments feel quite simple. You lie back, the applicator is positioned, and you feel cold pressure, sometimes discomfort, until numbness sets in. Sessions typically last under an hour, and at the end of the procedure, the hard part feels over. You go home, no bandages, no downtime, no obvious warning signs. For many, the fat freezing process leads to gradual fat reduction over weeks to months. This is where you relax and think, that was easy. This is where most patients aren't concerned about delayed complications because visually nothing looks wrong initially. During this relaxing time is where unwanted results start to set in. And the time delay of those risks deserve far more awareness prior to the procedure than it often gets, because what can happen next doesn't feel connected to the fat-reducing objectives of the procedure at all. Simply put, this is where your expectations may not match results at all. One of the most serious complications associated with fat freezing is Paradoxical Adipose Hyperplasia, or PAH. PAH is a rare but significant side effect where the treated area grows larger instead of shrinking. It typically appears several months after the treatment and is characterized by a firm, painless enlargement of fat tissue that can simply be something you do not want hanging off your body. By the time PAH appears, the original appointment is a distant memory, and although rare, it's not impossible. While considered uncommon, a 2025 review in Aesthetic Surgery Journal shows that PAH affects about 1 in 455 fat freezing patients, often months after treatment. And again, while uncommon, the negative results of fat freezing are probably far from anything you want to see on your body. PAH is far more than a minor side effect of fat freezing. Instead of reducing fat, tissues thicken and expand, and often in the exact shape of the treatment applicator. The very device meant to contour the body can leave a visible, firm reminder of the treatment itself. One of the most widely reported cases involved supermodel Linda Evangelista, who publicly shared that fat freezing left her permanently deformed, requiring corrective procedures and causing years of emotional distress. She stated that the treatment did the opposite of what it promised, and fixing PAH is far more invasive than the original procedure. The firm, noticeable protrusions of PAH do not magically disappear. They do not dissipate on their own. And in many cases, to fix it, you'll need to pay for surgical correction, like liposuction or excision, meaning cutting it out. Understanding risk isn't about fear, it's about informed decision making. Before considering fat freezing, consider exploring the questions you should be getting straight answers to prior to booking the procedure. Next, 20 critical questions and answers so that you can make more confident decisions regarding fat freezing. A question many patients start with is, what is fat freezing actually doing inside my body? Well, fat freezing works by cooling fat cells to a temperature they're sensitive to. And over time, those damaged fat cells break down and are cleared by your body. Aesthetic Surgery Journal explains that this cooling process is designed to target fat cells while largely sparing skin and nearby structures. So, if fat cells are being affected directly, how much weight can I lose? Well, sadly, fat freezing does not work like weight loss. It doesn't change metabolism and it does not reduce overall body weight. It's meant to adjust shape in a specific area. In fact, a 2021 article in Aesthetic Plastic Surgery makes it clear that cryolipolysis, commonly known as fat freezing, is a body contouring treatment, not a weight loss solution. So if fat freezing cannot reduce weight, what kind of fat does it actually reduce? Fat freezing works on subcutaneous fat, the soft layer just under the skin that you can pinch. It does not reliably affect visceral fat, which sits deeper around the organs. A 2020 review in dermatologic surgery highlights this difference and explains why fat freezing changes shape, yet does not address the health risks tied to deeper fat. Once patients truly understand which fat can be treated, it's common to ask how much fat reduction do patients typically see. Most patients see a modest change, not a dramatic transformation. Fat freezing is designed to thin an area, not remove it entirely. Industry journals report average reductions of about 10 to 25% of fat treated layers. Hearing that range usually leads straight to a timing question, like how long does it take before results show up? To be clear, fat freezing works slowly. Your body needs time to process and clear the recently frozen fat cells. A 2020 article in Aesthetic Plastic Surgery indicates that visible changes often begin around 6 to 8 weeks, with continued improvement over several months. That waiting period is usually when patients can pause and debate whether the procedure was right for them. They ask, was I actually a good candidate for fat freezing? Good candidates typically have small, well-defined areas of pinchable fat. They also have realistic expectations about subtle change. People looking for weight loss, skin tightening, or dramatic reshaping are often disappointed. A 2021 article in Journal of Cosmetic Dermatology notes that patient selection is one of the strongest predictions of satisfaction with cryolipolysis, fat freezing. Once patients decide they might be a candidate, attention hopefully turns to safety. Before booking, many patients think if fat freezing is FDA cleared, that must mean it's safe, which isn't really a question, it's an assumption. FDA cleared means a device met regulatory standards for a specific use. It does not mean complications are impossible. It does not mean outcomes are guaranteed. JAMA Dermatology explains that FDA clearance reflects baseline safety, not zero risk. That understanding leads to a much more practical question. What side effects should I realistically expect? Most people experience temporary effects like swelling, numbness, bruising, or soreness in the treated area. These are part of the body's normal response to cold exposure. A 2020 article in Lasers in Surgery and Medicine describes these short term effects as common and typically self resolving. But not every issue appears right away, which raises a very important question. Can problems appear weeks or months later? The short answer is yes. Some effects don't show up until well after the treatment feels finished. The Aesthetic Surgery Journal has reported delayed issues after fat freezing, such as prolonged numbness, nerve sensitivity, and contour irregularities. When patients hear that, they tend to get much more specific about their questions. For example, they might ask point blank, are there factors that increase the risk of complications like PAH? And certain factors do appear to increase risk, including older applicator designs and repeated treatments in the same area. Risk also increases when expectations don't match the potential of the treatment. And this mismatch in expectations drives post-procedure questions like, why do I feel like fat freezing didn't work for me? Well, when results are subtle, they can be hard to see, especially if expectations were high. Body shape, fat thickness, and applicator placement all influence outcomes. A 2021 article in Journal of Cosmetic Dermatology shows dissatisfaction is most often linked to anatomy and expectation mismatch, not device failure. Once disappointment sets in, attention can shift to delayed risks rather than early side effects. That's when you might start asking, what is paradoxical adipose hyperplasia, or PAH? It's a condition where treated fat becomes larger and firmer instead of smaller. The area often takes on defined shape that mirrors the applicator. A 2020 article in Plastic and Reconstructive Surgery describes PAH as painless but visually significant. And after learning a bit about PAH, the next question is usually, how often does it occur? PAH is uncommon, but it does occur. A 2025 article in Aesthetic Surgery Journal Open Forum estimates PAH occurs in about 0.22% of fat freezing patients, roughly 1 in 455. That statistic naturally raises questions about timing. When does PAH usually appear? Well, PAH does not appear immediately. It often becomes noticeable months after treatment. A 2021 article in Aesthetic Plastic Surgery indicates PAH typically shows up between 2 and 6 months after fat freezing. Once it appears, patients want to know whether it can resolve on its own, and the answer is a big no. PAH does not typically resolve on its own once it develops. So, how is PAH treated? The answer is that PAH is most often treated surgically. Removal may require liposuction or excision, meaning the physical removal of the thickened fat tissue. These are the most common corrective approaches. Outcomes like this often cause patients to reflect on questions they should have asked earlier in the process, like, does the provider's experience affect fat freezing outcomes? And yes, provider judgment plays a meaningful role, especially in patient selection and treatment planning. An article in Dermatologic Surgery links better outcomes to experienced providers and careful planning. But if you're beyond these initial questions and your fat freezing results have fallen short of your expectations, you may be asking, if fat freezing didn't work the first time, is repeating the procedure worth it? Repeating treatment may help in select cases, but it does not overcome anatomical limits. A 2022 article in Aesthetic Plastic Surgery indicates repeating fat freezing treatments offer limited benefit when body composition is the main constraint. This often leaves patients reassessing whether their expectations matched what the procedure could realistically deliver. That leads many patients to ask, in hindsight, what expectations lead to the most disappointment. Expecting fat freezing to behave like weight loss, skin tightening, or surgery simply leads to frustration. A 2021 article in Plastic and Reconstructive Surgery shows dissatisfaction is highest when expectations exceed what fat freezing is designed to do. Which brings everything back to one final question. A more useful question than, will it work, is what does success realistically look like for my body? And what happens if I don't get it? The British Medical Journal demonstrates that patients who ask this up front report significantly less regret. Understanding the risks of fat freezing isn't about fear, it's about asking better questions earlier. If this helped you think differently about fat freezing, subscribe to Beauty Seek for more straight talk so that you can make confident aesthetic choices. Next, we'll report on an alternative procedure to fat freezing right here on Beauty Seek.